Good afternoon. We are Team 36 from Transform. Our goal is to offer a secured communication service.
So herein lies the problem. Patients in care, they can be there for an extended period of time. The son calls, wants to know how their father was doing last night. How was their night? Later, the daughter calls and says, how is my father doing last night? How is he doing now? What did he eat today? The wife is at home wondering, how is my husband? And meanwhile, the patient is wondering, how is my wife? Did my daughter pass her exam yesterday? So the patients become, over a period of time, they become even more disconnected from their families and their friends and their loved ones, and their social health begins to suffer.
So the question is, how do we bridge the communication gap in the circle of care? So the offering that we're trying to provide here is a cloud-based solution that provides secured communication services. Leveraging the cloud technology, we could provide a secured, scalable, and cost-effective solution. Our offering bundles APIs that allows for enterprise integration and web services. So the messaging services can be accessed by any device, and especially mobile telephones. The feature of our services include HIPAA compliances from an IT and security side. Also information, recognizing that you're getting current, relevant, and from the source information. Extended partnership. Yes, there's an opportunity for revenue based on advertising and vendor partnerships. Finally, personalizing a healthcare platform to enable new interaction opportunities with patients.
So what does this look like? So our service will provide the venue to post status updates, goals about the patients on a shared noteboard. It will provide a place to put an ask a reminder sticky note so that the patient can say, oh, I need to ask my caregiver about this. It will have a media location where people can put up their videos, their pictures. The birthday of the granddaughter that they're missing can get posted up there in real time while they're blowing out their candles. I think one of the most important ones is a doc spot, where the doctor can actually upload a memo or a video to say, this is directly from me to you, if they can't see them in face-to-face. And some other generalized information, discharge instructions, follow-up, that kind of thing. It'll hopefully get us an improved patient experience, increased autonomy, decreased isolation, decreased separation feelings, decreased interruptions of the caregivers to have to go continually answering those phone calls.
So the goal is improving communication, improves the experience, which improves the outcome.
So, thank you to Team Transform. Okay, questions from my judges?
So the patient's going to be using the phone?
So we didn't really limit that because there are some organizations that have interactive internet access through their phone, like their television sets. Could be a patient's, it could be an iPod that the organization provides, could be a personal device, could be a family member's device.
Okay.
There's no real limit to that.
Because then my question just goes to, why don't they just text their family members?
So the thing I think that's most important, and maybe I didn't highlight it well enough, is the ability for the caregivers also to put in those status updates of, you know, had a great night, slept well. They're going for an ultrasound today. There's a test result back, that kind of thing as well.
And one of the things is that it gets posted throughout. You know, you don't have to text one person, but one thing is being posted and it goes in the diagram.
So to anybody that patient allows the security to, right? So if they have 4 siblings, then all 4 would be getting the exact same information.
Also, part of the key.
Another question.
Just a philosophical question. Instead of building from the infrastructure up, would you consider acting on top of Facebook? You've got 1 billion people on the planet.
So we talked a lot about that, and the biggest concern was related to it is personal information. It's a very fine line about what's HIPAA and what's not. And so we struggled with that one a lot, right? There's you know, that whole security concern. This is supposed to be a confined microcosm of users, and information ends at the time of discharge.
Also, the key here is to ensure that you could get information coming from hospital systems as well. So it's more of a consolidation of a space.
Okay, thank you very much.